Diagnosis and treatment of jaundice in babies. Babies will be checked for jaundice in the newborn examination within the first 72 hours after birth. After the baby has passed the examination, keep on the lookout for the signs of jaundice in your baby. If you suspect your baby has jaundice, speak to a doctor as soon as possible to perform these tests. Number 1, visual examination. Number 2, bilirubin test, either by a bilirubinometer or a blood test. And other blood tests may be performed if the jaundice continues. The blood can be tested for the baby's blood group, antibodies, number of cells in blood, infection, and amount of enzyme in the blood. Mild jaundice will go away on its own, but in more severe cases, jaundice may be treated by light therapy. Intravenous immunoglobulin reduces the mother's antibodies, and exchange transfusion, taking the blood and diluting the problem substances. Home remedies for light cases are more feedings and supplementing different feedings. Prevention of jaundice in babies. There is really no way you can prevent jaundice in newborns, but during pregnancy, you can take blood tests to see if you can rule out the blood group incompatibility and follow the below treatments to make jaundice less severe. For breastfeeding, feed babies 8 to 12 times a day for the first week. With baby formula, feed babies about 2 ounces of the formula every 2 to 3 hours in the first week. Complications of jaundice in babies. Acute bilirubin encephalopathy. In severe jaundice, the bilirubin might pass into the brain. This can cause damage if not treated. Dranicarus, the permanent damage caused by bilirubin to the brain. Now let's move on to adults. Causes of jaundice: inflammation of the liver, inflammation of the bile duct, obstruction of the bile duct, pseudojaundice, eating a lot of carrots, melons, and pumpkin. Prehepatic occurs before the hemoglobin reaches the liver. Hepatic occurs in the liver. And posthepatic occurs after the bilirubin has left the liver. Symptoms of jaundice: yellowing of the skin and whites of eyes, pale-colored poo and dark-colored urine, swelling, nausea, vomiting, fever, headaches, confusion, weakness, abdominal pain.